Howdy ho everybody, Nisa D. It is Friday, June the 22nd, and I decided to do a quick video tonight. Hopefully it's quick. I keep having to redo it because it's going too long, because today I had my plastics consult. Yes, I did. I talked a couple of weeks ago about how it was causing me angst and anxiety, and I was thinking about canceling it and going in the fall because I still wanted to lose another 20 pounds, and maybe I should wait. What it all comes down to is I was really deathly afraid that he was going to walk into the office and look me in the eye and say, "You still haven't done good enough. You're still too fat. What are you doing here?" Now, he would never put it in those words, but bottom line, that's what I thought would come back. Wasn't even part of the discussion. It wasn't. I had, of course, recorded my height and weight for him in the forms that I filled out when I got to the office, but he didn't even talk about weight or anything. He examined me. He does not do brachioplasties or medial thigh lifts, so that wasn't even part of the we had a discussion about that, and if I have time, I'll talk about it at the end, but he doesn't do them, so he does do the breast lifts and augmentation, obviously, and the abdominoplasty. The breast would cost me between $8,000 and $10,000. He didn't actually examine them because that would be part of a separate surgery. So, but he did give me sort of that as a base price to go from. The abdominoplasty would also cost between $8,000 and $10,000. However, he is 100% certain that Sask Health will pay for my abdominoplasty. I was so relieved that I forgot to ask him a whole bunch of other questions. How silly is that, right? Anyways, and I mean that truly. I came home and had been home for a couple of hours, and it hit me, and I started to cry. Happy tears, not sad, but just tears of relief, because I really didn't know how I was going to come up with the kind of money that I would need to have everything done that I wanted to do. And as soon as he said that Sask Health would pay for my abdominoplasty, I suddenly realized that I would be able to find somewhere to get my brachioplasty done and pay for it myself, that I could afford that for sure, and that I wasn't even sure if I wanted to get my breast done, because this part I can manage with a good bra without having to wear a lot of multi-layers of clothing and stuff. So yes, it's funny, like, because as soon as I knew that my stomach would be paid for, the breasts and the thighs became kind of irrelevant. Not irrelevant completely. I mean, there's still things, but I will wait and see how I feel after I have that done. And I know I do want to have my arms done. He does not believe in doing circumferential body lifts. He feels that he gets better results and less complications if he does the front and then the back. He said when he does the front, he has the bed slightly inclined so that your body's in a slight V, because he can get a much tighter pull on the abdomen, and that as a result of that, in fact so tight that he said it'll be several days before you'll be able to stand fully erect. But he feels that it's too much pressure if you have it all around, that you can't protect your abdomen as well. So I'm going to wait and see, because I actually had all along up until about a month ago not thought that I would have a full circumferential done anyways. So we'll see what the end result of the abdominoplasty is. I will go with him. I actually feel very comfortable going to see him. I mean, having him do it and not going to see anybody else, because the reason I picked him to go to is after conversations with 3 other physicians that I work with, have worked with quite closely in my job, and have also known from when I was nursing. So one of them was my family doctor for about 18 years before he left family practice medicine to do emergency medicine. So I trust him, and I asked him and the head of the hospitalists for the region if they were sending their mother or daughter or wife for this type of surgery, who would they send them to? And they both said this physician. So that's why I'm going to him. And I was very comfortable with him. He seems like a lovely man, but he also seems like a very competent surgeon. So I'm okay with that. Now when? Timelines? Well, I have to quit smoking first. So that's my job this summer. I still want to lose 20 pounds. So that's my job this summer. He is, however, going to, because he was ready to start the paperwork and stuff if I was not smoking, and I said to him, well, he asked me actually, he says, do you want us to take the pictures and send it in and get it going? And I said, yes, actually, I would like that. So normally the process would be is they would send that in, and then when they got the reply back, they would call and let me know. He said, but what I will do is I will get you to call me when you've quit smoking, and we'll talk about planning. Because I told him I still want to lose another 20 pounds, and then I didn't want to have surgery for probably at least 9 months to a year after that when things had settled in, which he agreed to. But he kind of chuckled and he said, well, then we're good to go, because the waiting list for elective surgery here in Regina, because this is still considered elective and cosmetic, is a 12 to 18 month wait. So, so I think timeline-wise that will be good. Now the other thing that while I'm waiting for that, I can do is investigate, because I would have the brachioplasty done probably a little sooner. And if I'm going to go somewhere else anyways, and I'm waiting for a year to a year and a half to have the abdominoplasty done, I potentially could go elsewhere and have the brachioplasty done after Christmas sometimes next year. So that's my plan, and that was my good news. And I just really wanted to come on and share with you guys, because I really, I mean, I was a mess. I was a mess. And it came down to, again, that base fear from so many years of being judged again. So, that's all. This is 7.5 minutes. That's long enough. I'll talk about a couple of other things in my update, but I just wanted to share that all with you. I hope that you're all doing well. I hope that you have a great weekend. Take care of yourself. Take care of each other. Make a great day.